Good morning, everyone. Welcome. Is this picking me up? I think so. All right, good morning. Wonderful. It's so great to see you all this morning. Welcome to the Colorado School of Public Health at CSU's inaugural orientation part 2. So thank you all for being here. I'd just like to mention a few housekeeping pieces before we get started. We have a pretty packed agenda with lots of great information for you. First piece is just out this room and to the right are the restrooms. Feel free to take care of your needs during this morning, and also feel free to help yourself to food and beverages as needed. Second piece is we are recording this event, and I want to let you all know that we are not recording the audience. Your likeness will not be on this recording. It's mainly to capture our presenters. With that, I have one other piece that one of your colleagues asked me to let you know, and I just want to bring it all to your attention that you all are welcome to post to the MPH and beyond. MPH, CSU, Facebook, and beyond to our Facebook group. So please use that as a resource and share things as you would like. With that, I am going to hand over the microphone to our Dean, Elaine Murato, and she will be providing a welcome and introduction for all of you.
Good morning. I didn't get around the whole room, but I tried to get it to everyone that was here for the first part. So for those that I didn't get to meet you in person, I'm sorry. But welcome you all here. I think it's so exciting to see all of you here around here talking and getting ready to talk about your capstone and practicum experience. So people are asking a little bit of who are you and what sort of inspired you in public health. And so I'm just going to share a little bit about it and how I think the practicum and capstone and the things that you'll be talking about today are really a great opportunity to springboard to where you want to go when you finish your program. And I always like to begin with the end in mind. And why are you here in graduate school, and what are you hoping to learn out of it, and how is it going to help you get to where you want to go in your own personal goals? So I was introduced as the dean. I'm really the interim dean. I'm the associate dean for public health practice. So I care a lot about how we take our learning from campuses and actually make it into the field and into practice. And I've been serving as our interim dean since last December. And in a couple of weeks, our new dean will be arriving. Dr. John Samet. He's coming from University of Southern California. But the reason why I mention it for two things. One is he was my teacher when I went to graduate school. So I am an epidemiologist, and I'm interested in, as I said, practice translation and policy. And he taught a course that was elective on epidemiology and policy. And I had him as a teacher. He was the department chair for the track that I did. And so you might never know who from your cohort here, who among your faculty you might encounter in other and new ways. But I think what's really exciting is that he has a real strong commitment to students. And that I was telling one of the tables that even though he is now transitioning here, in his last month of duties, he was still teaching. And so at USC, there's an undergraduate program that's part of the graduate school, and he was teaching undergraduates and graduate students about public health. So I know he has a real passion around the educational experience and how we can continue to innovate, be responsive to learning needs, and so forth. And so I imagine as it gets planned, we're kind of planning that he might be doing welcoming student kinds of things like this, probably in the new semester. There's nothing more disruptive for students than trying to do something that's right before finals, you know. So we'll, stay tuned and look for more. But I got into public health for a couple of reasons. One is I love lots of different things. I liked math and working with numbers. I liked thinking about psychology and how people worked. I liked government. I always loved history and how laws were made in policy. And I could just never decide where do I want to focus. And so the MPH, and I also have a DRPH, allowed me to see all of these different disciplines as interconnecting with one another. And so I'm in a Department of Health Systems Management and Policy. So I think about health systems and policy. I'm trained as an epidemiologist, so I like to work with numbers and data. And so I'm able to use numbers and data as to inform policy. And I think that's what's really neat about public health is it allows you to take your various backgrounds. Some of you are lab-based, some of you are journalist-based, some of you have other kinds of backgrounds, and really mix it together with this core curriculum, but then choose your electives and your concentration to kind of give you the focus that you're looking for. And for me, the practicum and the capstone experience was sort of life-changing. So not to put too much stress on you as you're thinking about it, but do be thoughtful. It's not just about, gee, I have to do this so I graduate. Think about it in a thoughtful way of where is it you're wanting to go and how can you use this as a learning experience to help you to get there. You have the student card. Places like to work with students, and you can come in and instead of saying, hey, I'm looking for a job here, I'm looking for a learning experience here. How can I help you? How can I contribute to your mission? And it opens doors. And I was telling one table, for me, I used my capstone experience. I was working at Procter & Gamble developing drugs, but I really wanted to get involved in FDA policy and how you regulate drugs and the safety in that. I was able to use the alumni network of the institution where I was, and I started cold calling people and reaching out to people at FDA, looking for capstone kinds of projects. I found one, and that person who worked with me continues to be a mentor and advisor to me. She was on my dissertation when I did my DRPH. She helped me make connections with others within FDA. I sit on advisory committees, and it's been a lifelong mentor for myself. So if you kind of go in with that, how can I make the most out of this? You know, that helps me learn something, but helps me maybe make connections, helps me explore areas. And it's okay if you find out, ooh, I explored it, and that's really not where I want to work or do, because that's part of the learning experience too. And so I think it's really great. I was telling Dr. Salonis and Aaron as well, I think it's really great that you're doing this about 6 weeks in, because you all now have more of a taste of what is these public health classes all about, and I think you are more informed consumers around, you're probably starting to think, what is it I want to be doing next summer? And so I really encourage you to take advantage of the opportunity today to challenge your thinking around how you can make the most out of it. And I have really enjoyed being in the interim dean. It has allowed me to be more on the campuses. I think what's really cool from my perspective on CSU is it's a very applied learning, get out and do kind of environment. And I think this is your cohort, you know, and so really encourage you to get to know each other as part of this experience as well. And you're coming in at a great time. In 2018 will be the 10th anniversary for the school. And so we will be doing special events and speakers and symposium. You'll be hearing more about that. So I think you'll get an added kind of learning experience. The other piece is that it's also the 10th anniversary of the Colorado Public Health Improvement Act, in which the state of Colorado came together and said, what can we do collectively as a state to improve public health? So it's just another wonderful opportunity to be celebrating what's the accomplishments, contributions of what is public health and how that's really improved the state. And I think it's also cool that you have not just us saying great public health, but recently there was a story that the president of CU and the president of CSU came together, and one of the things they talked about and how does CSU and CU work together was in the public health area. And, you know, it's a shout out at the very high levels that what we have here is a school, and we're always trying to get better. So you may encounter things that aren't always perfect from your perspective, but the commitment that we really think of ourselves as in this Colorado space, in the region, to really make a difference and learn from the unique talents and disciplines across the 3 universities, I hope you'll find is a unique learning experience for yourself. So I'm grateful that I got to come up here today and spend the morning with you, and I hope it's a great day for yourself. And it's a Friday, and so Fridays are always good too, right? So so I thank you, and have a great day. Yeah.
Thank you so much, Dr. Murato. Next up, we have a Zoom session. So Zoom is our equivalent to Skype with an individual from financial aid. I'm going to pull that up for you all, and Gail Sasau will share some information with all of you on financial aid specifics. Yep. And that's our meeting. I sent her the meeting link. $10:15.
Do you need to sign in?
I think so. And it says 1 participant. Let me go into my email. I just don't see the individual who was supposed to be there actually logged in. So I'm going to make sure that we're good to go, and let's see. Yeah. It shouldn't. She should be able to just, yeah. She's accepted the event. Try it that way. Maybe. wondering if she didn't log in. Or if, again, there's something on my end. This meeting is in progress. Let's try. I'm sure I can pull it up. I bet it's on. So like they set us up and then like is that you? Yeah, but let me look at Gail's. Well, I'm trying. I don't know other than selecting it. I'm gonna see if Kendra doesn't mind jumping ahead and doing some practicum stuff, and then I'll try to get Gail on the phone.
Erin. I don't know what that means, but I mean, that's her.
That's her.
There she is. I don't know if it's on mute, if that's going to be a problem.
Gail, can you hear us?
It's on mute right now. I just want to make sure.
Yeah, you need that on.
Okay. All right, so it is on now.
But I'm not hearing her. Gail, are you there? Can you hear me?
It's got the HDMI, so
Could I ask everyone to quiet down so that we can make sure our audio is working? Thank you. I'd say 5 minutes to fix technical issues is not the worst case scenario, right? I love hearing all of you chatting.
oh wait, this is her now.
Ah, Gail, I think you're on mute.
Erin?
Yes, now we can hear you.
Oh, great. Cool.
We did it, Gail. All right, you have a room full of about 50 students here that are so excited to hear your information. So I will turn it over to you.
Perfect. Okay, welcome everybody. I'm so sorry I'm a few minutes late. Let's get started. I'm just going to give you some real general basic information about financial aid for your program. And if you have any questions, if you're able to ask now, fine. If not, feel free to contact me. I'll give you my contact information at the end of the presentation. Let's go through your CU account checklist first. If you're receiving account, you may get all from us as a reminder.
That's from her.
Some information in a couple minutes on food conduct. Is your bill paid in full as of today? Make sure your bill At the end of the semester, when it's time to register for spring courses, you won't be able to register. The Bursar will be putting a hold on your account if you still have a bill due. You just set up direct deposit. This is the fastest and easiest way to get your remaining financial aid after your bill is paid in full. If you don't set this up, and I understand if you can, this is not mandatory, but if you don't set this up, what will happen is the Bursar will mail a paper check to you. You'll have to wait for it, and then you'll give it to the bank.
Gail, I'm sorry, I'm going to stop you. You're cutting in and out, and we're not seeing your video. Right now, we see an email.
So it's better if you can set up for direct deposit.
Obviously, there's some kind of delay.
And then did you complete commission? Because if you're buying this, you have charges on your bill that you want financial aid to pay, you have to give the Bursar office permission, and you can get this done on the portal. So everything I've mentioned so far is on UC. At CSU, but you'll have to access us through to help with any of the items we just mentioned. Contact the Bursar's office, and they can help you with troubleshooting anything on your account as far as what the bill due date is and all of that.
Hey, Gail.
Yeah.
We are unable to see your screen. If you could put it onto, right now we see an email or your invitation for this Zoom meeting, and you're breaking up a lot.
Okay. I shared it again.
Apologies, you all. This is the first time you've done this, if you can't tell. Try it later. Oh, what are you doing?
Unmute share. Are you able to see the screen now?
We are. We're able to see it, not in presentation mode, but this is sufficient.
Okay, we're okay. Let me see. Can I still forward? Yeah, that is strange, because now I cannot move the screen forward. That's really odd. Okay, so definitely I will share the screens, the PowerPoint with you guys. So let me just at least verbally go through all the steps, and then I'll forward the presentation to you, and then at that point, then feel free to email or call me with questions. So the next slide is we're going to go through the financial aid checklist. And the earliest date that financial aid can be applied to your student account is the week before your semester begins. So no earlier than that will you see financial aid applied to your bill. Now this is if you already accepted your financial aid and you already completed the loan requirements, and I'll go through that in a few minutes. So that's the earliest that you can see financial aid applied to your bill, is the week before your semester begins. And at this point, you should check to see, did financial aid apply to your bill? Did all of it apply to your bill? Is your bill paid in full? And then go through the steps of troubleshooting. Did I accept all of my financial aid? Did I do the loan requirements? And then contact us if you need any assistance, because you're not real sure what's going on, but your financial aid has not been applied to your bill. And if you haven't been awarded, maybe we're still waiting for you to submit documents. So check your to-do list in the UCD Access portal to see if we've requested anything from you regarding awarding financial aid. Maybe we might need a tax document, or we might need a form filled out. So feel free to give us a call and we can help you with that. Continuing with the financial aid checklist, just know that financial aid cannot exceed cost of attendance. So if you're receiving any award from outside the school, such as a scholarship, tuition payment from your employer, maybe a military scholarship, a grant from another agency, those things will affect what you are receiving now, or could affect what you're receiving receiving now. So if you did accept all of your financial aid and we see that you have other financial aid coming in from another source, we may need to reduce your financial aid. And we try to reduce the loans with the highest interest first. So your Grad Plus will be the first thing that we touch. And if you don't have a Grad Plus loan, then we try to reduce your unsubsidized direct loan. So we try to reduce your loans if you're getting financial aid from another source outside the school. Now, for those of you who were awarded the Colorado Graduate Grant, and this grant is not awarded to all students, you must qualify. So if you qualify based on what we saw in your FAFSA and you got the Colorado Graduate Grant, remember you must be enrolled in at least 4 credit hours every semester, otherwise the grant will not pay. So just remember that, 4 credit hours every semester to receive the grant. Now what happens is that census, which is about 2 weeks after the start of the semester, at census your financial aid may be reduced because maybe you got awarded for financial aid based on 12 credits, but since then you dropped and now you're down to 6 credits, so your financial aid may be reduced to reflect that you're taking less credits. So just be aware that you may get an email from us saying we reduced your financial aid. Feel free to call us if you're not quite sure what happened and you need to find out why we reduced your aid. Feel free to call. Remember to apply for financial aid every year that you need financial aid. The FAFSA is available from October 1st. So this coming Sunday, the FAFSA is going to be available for the 2018 to 2019 school year at FAFSA.gov. And the FAFSA will be asking you for your 2016 tax information. So moving on to loans and loan term and condition, the interest rate for this current school year for your Stafford loan, your direct loan, is 6%. And there's an origination or processing fee of 1.069%. So what that means is the Department of Ed will be deducting 1.069% from the loan before the money is applied to your account. So if you need $5,000, make sure you add 1.069% to the $5,000, otherwise you're going to be short when that origination fee is deducted. For the Grad Plus, the interest rate is 7%, and their origination fee is 4.276%. It's huge. So again, if you don't need to borrow the Grad Plus, we highly recommend you don't. If you need it, that's fine. And there is a credit check requirement for the Grad Plus. So just make sure your credit is good to go, otherwise you may not be able to borrow the Grad Plus. And I'll talk about credit in a few minutes. The interest rate is now market-based. It never used to be. It used to be just one set rate every year. But now it's based on the market. So every year, the Department of Education is going to assess the economy and see what's going on. And they're going to be using what other lenders are using. So they're using the economy to determine whether they increase or decrease your interest. So come July 1st of every year, we're notified whether interest rate will go up or down. The loan interest rate is fixed for the loan that you're borrowing for that school year. So for example, this school year, your loans are all fixed at 6% or 7%, depending on which loan you're borrowing. So it'll be fixed for 6% or 7% for the life of the loan. Next year, if the interest rate goes up or down, it'll be fixed for whatever that interest rate is for next year's loans. Okay, so continuing with terms and conditions, the direct loan has an annual limit, of $33,000 for the Master of Public Health and the Doctor of Public Health program, and a limit of $20,500 for the certificate, the Masters of Science, and the PhD program. The lifetime limit for the direct loan is $224,000 for the Masters of Public Health and Doctor of Public Health, and $138,500 for the certificate, the Masters of Science, and the PhD program. For the Grad Plus, there is no annual limit, but again, financial aid cannot exceed the cost of attendance. So the Grad Plus fills the gap. So what happens is we take the cost of attendance, we award the unsubsidized loan, and then whatever's left in your cost of attendance, we can award up to in a Grad Plus loan. So that's how it's awarded. Now these loans do qualify for public service loan forgiveness, and I'll give you some information in a few minutes on how to get more information about public health loan forgiveness. Always retain a copy of your promissory note. It is a legal document. It's your promise to repay the student loan. It has information about the interest rate, the processing or origination fee, and all of that on the promissory note. For both loans, interest does accrue while you're in school, so just know that. You can make interest payments while you're in school. Contact your loan servicer for instructions on how to make payments of interest payments while you're in school. You can register online at your servicer's website to receive electronic information, but the servicer will be the one you need to talk to as far as how to make the payments, who to send it to, and what kind of payment they can accept. If you don't know who your servicer is, they did send you a welcome, or will be sending you a welcome letter saying who they are, how to contact them. And if you missed that letter or did not receive the letter yet, you can log into the National Student Loan Data System website and find their contact information there. More student loan information is available at ucdenver.edu, Anschutz, FinAid, student loans. And don't worry about writing this down, it'll be on the slide, so watch for the slide and then you can get to our website. It's our website and it has more information about student loans if you need more information. Financial aid can cover certain special circumstances. For example, if you have children and they're in daycare or have babysitting expenses, you might be able to get financial aid, which will be probably a Grad Plus loan or unsubsidized direct loan to cover daycare or babysitting expenses. We've got a form available. Same with the computer. If you need to buy a laptop or a tablet to do your coursework, you could probably get a loan for that. Or if you have unusual medical or dental expenses, maybe you broke your arm, now you have a medical bill that you can't pay, contact us or contact me and I can tell you what to do. Basically, you're going to go to our website, download the appropriate form, and then follow the instructions and submit documentation with the form, and then we can get that processed. And feel free to contact us if you have any questions on whether you might qualify for any of these, you might qualify for a loan to cover any of these expenses. We've got financial aid policies and rights and responsibilities on our website, and on the slide you'll see a link to that. They are required reading. You should read both websites to make sure you understand what the policies are so that you're not surprised with a bill because your financial aid got reduced for some reason. So the slogan I have on the slide is "Know before you owe." Many students do not read our policies and rights, and then they're surprised as to why they now owe a bill. So if you read the information on these web pages, you'll understand why your loan may be reduced and why now you need to return some money. Feel free to search for scholarships. The school public health may have some, but you can definitely search other sources for scholarships. There are scholarships out there for single parents, for ethnicity, religion, and maybe from your employer. There might be scholarships out there based on hobbies, interests, or having to do with your groups or organizations. So not only look for public health scholarships, but look for scholarships of this type so that you can apply for as many as you can. And on the slide, I have a link to our website for more information and to links to other sources for scholarships. there's a really good tips and tricks for obtaining scholarships on the Association of Schools and Programs of Public Health. And again, on the slide, I'll have the link to that website. And the tips I have for you today is to create an essay template for your scholarship. Most scholarships ask for the same information, employer information, curricular information, extracurricular information, community service information. So if you can create a template and then just tweak it for each scholarship that you apply for, they might ask for, a scholarship may ask for something in addition to these items, then it'll save you a lot of time to have the template, and then you won't be having to recreate the template each time you apply for a scholarship. The next slide now talks about managing your money. This is the best way to stay stress-free while you're in school. I'd rather you not be stressing about financial aid while you're in school because your curriculum already has a lot to do. So, if you can stay within the $2,000 per month living allowance that's set up by financial aid, then you'll be almost stress-free regarding financial aid. You can use mint.com to help you set up your budget and to stay on top of your expenses. Know when your bills are due, bill payments are due, check on your student loans. You can use mint.com for all of that. And we've got a slogan here in our office we always use with students: live like a student now so you won't have to later. I tell students, have your ramen now while you're in school instead of now you're having to have ramen while you're working because you haven't managed your finances well. So, I would say cut down the expenses now while you're in school. Look at what kind of expenses you have. What are you spending on that maybe you don't need to spend on while you're in school? For example, if you need if you get a latte once a day, maybe you might cut it down to once a week, something like that. The next screen talks about managing your credit. The Grad Plus loan needs a credit check. So if you have good credit, nothing's wrong with your credit, there's no adverse credit history, then you should be fine with obtaining a Grad Plus loan. The best thing to do is go to annualcreditreport.com. And there are 3 agencies there that you can check your credit with. And what we recommend you do is you stagger running your credit report. So Equifax is one of the agencies. Maybe you can run Equifax in January. You can do Experian in May and TransUnion in September so that you'll have a credit report throughout the year. And when I say check your credit, I mean really check it. Take a look at your credit. If you need to print it out or save it as a PDF to your computer, that's fine, but check your credit and make sure everything there belongs there. If you worked with a creditor and they said that they were going to take the adverse credit history off because you've already resolved the issue with them and it's still on your credit, that needs to come off. You need to talk to them. So you can work with your creditor and the credit reporting agency to get that off. If you see something there that's reported and you have no idea who they are, you've never had business with them, that could be a false report and that could be hurting your credit. So work with the credit reporting agency where you found that credit report and make sure you get that taken care of. Otherwise, you may not be able to borrow Grad Plus or any other kind of loan if there's an adverse credit on your credit reports. The next slide talks about manage your student loans. Loan repayment should be deferred if you're at least half-time enrolled, which is 3 credits per semester. If your loans are not in deferred status and they are in repayment status, you may want to contact the registrar's office because the registrar's office notifies the lenders every semester that you are still enrolled at least half-time. So you may want to contact your servicer or your lender and say, hey, I'm in school at least half-time. They may have you print their in-school deferment form, and then you'll fill that out and you give that to the registrar so they can confirm your enrollment and they can send it back to your servicer or your lender so they can update your account. All of this information is on the slide, so when you get the slide, you don't have to worry about taking notes now. You can refer to my slide when I send it to you. There are other resources too. If you're a vet or in the military, we do have a veteran and military student services office. Their information, their link is on the slide as well. If you're receiving scholarships from outside CU, we'd like to know about it, so you can contact Scotty in our office, and I've got her email address on the slide. And if you're receiving third-party payments, such as a military payment or a payment from your employer, voc rehab, something like that, then you can email our office, and I've got that email address on the slide as well. For information on public service loan forgiveness, I've got the link on the slide as well. But if you go to that website, you'll get more information about what is public service loan forgiveness, how do I qualify, what do I need to do, and they have a list of employers who do qualify for public service loan forgiveness. So you can get more information about public service loan forgiveness. Because for most of you, you probably will be working in an agency that qualifies, but you do have to qualify through the type of loan repayment you have and making on-time payments when you start repaying your loan. So this website that I'm giving you on the slide will give you more information. And feel free to contact me after you take a look at that and if you have other questions. So that's the end. If you feel like contacting me, I do have a slide. The very last slide is our contact us slide with advising hours. You can come in if you happen to be here at the Anschutz campus. You can call or email me. And I'd be happy to help you with any financial aid questions that you have. I'm sorry that the slide didn't work today, but I will send you a copy of the slides. Feel free to email me back with questions.
Thank you so much, Gail. I will look out for those slides from you, and then I can send those out to our students.
Perfect. Thank you, Erin.
You're welcome. Have a lovely weekend.
You too.
All right. Thank you all for your patience with that. Get my mouse back over here. All right, next up, I will invite Kendra up front, and she is going to talk with you all about your practicum experience.
All right, hello everyone. Hello. Hey. Please use the microphone. Sorry. Oh, yes, okay, so for right now though, MSW and PH students, please follow Kelly. You're gonna go out to a room, literally just turn left. And there are 2 MSW field placement advisors in there. Are we coming back? You will be. Yep. All right. Okay. No, wrong one. That's not my. Is it down further?
Yeah.
Oh, they're all
It's on
merged?
the screen. Yep.
Okay.
Mhm.
I didn't know it was all one.
Sorry.
That's okay. Okay, perfect. Almost.
Let's do this. Wonder if this one is.
Sorry. Scoot over more.
There you go.
Awesome. Thank you. Okay, so I'm going to spend the next few minutes talking about practicum, and then Dr. Stellens is going to come up and talk about capstone. So you're going to get to learn a little bit more detail about both of those things today. So, and please remind me if I'm very used to moving as I talk, so I'm going to try really hard just to, could we do that? All right. Is there going to be any feedback with the mic up there? Okay. Are we good? Okay. Oh, I can move. All right. So this is the only slide where I'm going to be talking about capstone. So one of the ways it's helpful for people to know what is practicum, what is capstone, is to really understand what the difference is between the two. So the practicum is like an internship. So it's a broad-based learning experience. Students spend time in a public health setting, working on public health issues. Students are generally going to have a few different activities, projects, or tasks that they're going to work on. The capstone project is much more focused. You really have one project, and it has your beginning point and a defined end point and some sort of end product. You also will probably work a little bit more independently on the capstone than you may on the practicum. So a little bit of how those are different. Students may work with the same organization for both of those, and you can complete the practicum first and then the capstone, or you can do them concurrently at the same time. But you're not able to do capstone first, followed by practicum. Any questions about that difference? Okay. All right, so why do we have this practicum? What's the purpose of the practicum? So one of the primary reasons why we have this practicum is so that students can take what they're learning in the classroom, the theories, the skills, the knowledge, and apply it in a public health setting. We also want you to enhance your skill set. So learn new things, gain new skills, have the opportunity to add things to your resume and your toolbox. Be immersed in a public health setting. Gain experience in current public health issues. Create a public health network. The people that you'll be working with, whether that's with faculty, a nonprofit organization, a governmental agency, these individuals will become part of your own network. So they may be able to serve as a reference for you later on when you're applying for jobs. They may know about jobs that they can forward to you. They can serve as mentors for you, as Dr. Morato mentioned. So that's another great outcome of the practicum, as well as addressing specific competencies from your concentration. You chose your concentration for a reason. You were drawn to that topic area. You wanted to gain skills in that area. So we really want you to make sure that this opportunity, this organization that you'll be working with, that experience, is going to hit on those competencies. So eligibility for practicum. You do have to meet certain requirements before you can begin your practicum experience. So students need to successfully complete the foundations course, and that can be at the course at any of the 3 campuses. Additionally, complete at least 3 other core required courses. Again, those can be completed at any of the 3 campuses. You need to complete at least a total of 18 credits, and then gain approval from your assigned practicum advisor. So generally, based on those prerequisites for being eligible for practicum, students are usually able to begin their practicum experience, if they're full-time students, after the fall and spring semester. So we do have a lot of students choosing to do their practicum in the summer term. And that usually is the earliest that most students are eligible, but the practicum can be done in any semester. The requirements for the practicum itself, it's a minimum of 120 hours, and we really want students to focus on the experience and not the hours. Okay, this isn't just about clocking your time. A lot of students will go beyond those 120 hours. But what we really look at is the quality of the experience that you're going to be getting. You will put together a set of predefined activities. You will work with that organization with a person who we call your preceptor. They're going to serve as your supervisor with that organization or that host site for you. You're going to work with them to define what those activities will be. So you're setting the expectation then for both of you, what their expectation is of you, and then what your expectation is of what you're going to be gaining from that experience. You submit all of your pre-practicum documentation, so that is everything that you need to submit to have your practicum approved in Canvas. So it's all submitted online, and as it says in red here, to remind me to say it, all of you are going to be invited to join our pre-practicum Canvas site after today's training. So you're going to be able to go in, look at all of the assignments, there's videos in there, really get a better feel for what you're going to need to do to get approval for your practicum. This is just a sampling of some of the places where students have completed their practicum experience. You can see there's a wide range from governmental agencies, nonprofits, schools, health institutions, opportunities abroad, as well as here in the US. Sky's the limit, really. Another opportunity available to students is with the World Health Organization in Geneva, Switzerland. We do have a special relationship with certain departments in Geneva, and this here is the website on our CSU MPH webpage. So publichealth.colostate.edu. There's a button to click on for practice-based learning, and at the bottom of that page is the link to the World Health Organization page. There are links here to the instructions for completing an application if you're interested in interning there, as well as the form. So there are 6 or 7 different departments that we have relationships with. We do have, we provide funding to students who receive an internship at the World Health Organization. It's a $3,500 stipend to assist with travel as well as living expenses. There is also a 2-step process in the review for applications for these internships. So you submit an application to me, and then we have a team of individuals who review those applications. If a student is approved at that level, then we nominate that student to the department that they identified in the application at the World Health Organization. Then it's up to that department to decide whether or not to bring that student on as an intern. So there is a 2-step process for that. Any questions about that right now? Yeah. It's usually 1 semester. A lot of the departments want you to commit to at least 3 months. Great question. Other questions? Okay. Another great resource for you is Colorado SPH Connect. Most of the opportunities posted here are in the state of Colorado. A lot of them are in the Denver area, but not all of them. Boulder County Health Department and the Colorado Department of Health and the Environment both post all of their internship opportunities on Colorado SPH Connect. There are other postings. I also will submit, if I receive something, I will submit it, so it is also posted on Colorado SPH Connect. So another good place to look for some opportunities. Okay, so let me see. I wanted to quickly show you what this might look like. Hold on a sec. Okay, so this is the pre-practicum Canvas site that you'll be invited to join. And in the assignments section, you'll see a listing of everything that you have to submit to receive approval for your practicum. So there are some things that are very simple, like submitting your resume. There's a short one-page skills assessment that you complete. You have to complete 2 online trainings. For anyone traveling abroad, there's a separate international approval process through CSU. So this really walks you through everything you need to do to get approval for your practicum. And we do, just as a reminder, we do want students to submit all of these assignments in Canvas as well, instead of emailing them to us individually. Okay. Hold on, see if I can get there. All right. Okay, so your assigned practicum advisors. So I serve as the advisor for animals, people, and the environment, epidemiology, and global health and health disparities. Dr. Chrissy Chard serves as the advisor for health communication, physical activity and healthy lifestyles, and public health nutrition. For people doing practicum in the summer, specifically anyone interested in epi or maybe an epi-related concentration, Dr. Molly Gutilla may be coming on board at that point to assist with that, but for right now, please contact me or Dr. Chard with questions. In terms of timing, if you're looking at a domestic practicum opportunity, really focusing your efforts on this, your search efforts and planning efforts the semester before. So if you're looking for a summer opportunity, focusing in spring. If you're looking for an international opportunity, really starting to think about it in this semester. You can still do the bulk of your planning in spring, but just at least having some conversations with your advisor would be probably beneficial to do in the fall semester. There is also funding available for practicum and capstone opportunities. Students can receive funding for one or the other, but not both. So you can get funding for practicum or capstone. We have the application on our website. It's on our student resources page under checklists and forms. It's also in the pre-practicum Canvas site. Okay, so what now? Now is really just the thought process and the planning. So as Dean Morato spoke about very well, really take advantage of this opportunity. Think about what your long-term goals are, and we really want to try and match your practicum and capstone to those long-term career goals. So that may include working on a resume and cover letter now, considering the professional strengths and skills you already have, as well as what you might want to gain. Look at Colorado SPH Connect. Watch out for those Wednesday emails that I send out with the practice-based learning opportunities. Even if there's something that is available now that you can't necessarily take advantage of, but you're really interested, make a note to yourself so you can maybe check that out later on. And I think that's it. So I'm going to turn it over to Dr. Oh, okay.
All right, flexibility, right, everyone? Okay, next we have Leslie Martinez, who is here to talk with you about CSU Career Services. And let me get the internet for you, Leslie. Is that okay, just an open tab?
Yeah, should be fine.
Okay, thank you.
Well, good morning, everyone. How are you all? Good. Yeah, pretty early, I feel. Sorry. So I'm Leslie from the Career Center. I'm a student ambassador there. I am third year. Oh my God, I still think I'm a second year. I'm a third year in social work and human development and family studies major with a concentration in early childhood professions. And, just here to talk about the Career Center. So how many of you have actually been or stepped inside the Career Center before? Okay, so a couple. Do any of you know where the Career Center is located? Where? Can somebody tell me? Yeah, so it's on the first floor. It's right next to the radio station and that one hall by the vending machines that people think is a hall, but really it's just like a closet or something, and people are always going in there. So yeah, we're located right there, and we really just help students, all CSU students, even if they're alumni, with career and professional development while they're here at CSU and even while they graduate. So what are some things you all really feel like you're going to need help with, especially now that you're grad students and you're about to graduate and all of that stuff? Resume review, okay. Anything else? Interviewing, perfect, cool. Yeah, so with resume review, we have a lot of really cool resources. I can show you some of our online resources, but I also want to tell you about our top resource when it does come to resume and cover letter building and CVs and all of that stuff. We have drop-in hours Monday through Friday, 10 to 2, and they're going to be at the Career Center. You just come in and say, hey, I want to drop an hour for a resume critique. You'll get just checked in, and it takes literally like no more than 25 minutes. So whether you have like a hour-long passing period or you're all done for the day, just go in, say, hey, I need some help with resumes, cover letter, even CV, or if you're applying to a specific job and you need help with the application process, we do all of that stuff during drop-ins as well. And then I'm going to show you some really quick resources. I'm really bad with technology, so bear with me. Oh, God. Oh, no. There we go. Cool. So this is what our Career Center website looks like. Have any of you ever been on the Career Center website? No? Kind of? Cool. Yeah, so we have three basic resources that we use here in the Career Center website, and it's RamCareer Tools, RamCareer Ready, and Handshake. So RamCareer Tools is kind of like, I call it the Google search of the Career Center. So if we press on it, this will be really helpful if you need help with resumes, if you need help with cover letters, or if you just want to look something up. So what I do here is I go on the drop-down menu, go on to resumes, and then, as you can see, there's actual resume examples. So let's say you just really needed a basic resume guide because you know how to do resume, but you still need some more structure and stuff. This is what it'll look like. And we have like an actual example where you can use this. If you don't want to come into your Career Center and get this, you could do this all through your home as long as you have Wi-Fi and know the website. So this is an actual example of a resume. And then down here, it tells you a bunch of really good main focuses and all of that stuff. I know that we do have specific resume guides for specific colleges. You are all in the College of
Graduate Program in Public Health.
Cool. Oh, nice. So I'm not sure if we have one just for grad students, but we definitely have one in regards to, we should have one here somewhere. Sorry, I don't know why I keep looking. In regards to all of that medical and biology and all of that stuff you need any help with, so you can definitely take a look at one of those. If you need help with cover letters, we also have cover letter help right here, or wrong one. Yeah, right there, cover letters. Perfect, so there you go, how to write a cover letter, step-by-step on cover letter guides, all of that. So definitely make sure you check that out. I did hear somebody, oh God, what am I doing? I did hear somebody say that they need help with interviewing. We at the Career Center actually have a mock interview program. And for that mock interview program, all you have to do is call and say, hey, I want a mock interview. They'll go ahead and set you up with one of our career specialists who actually performs those mock interviews. And then depending on your availability, what's your schedule like, what's their schedule like. And the cool part about those is that they're an hour long. And 45 to 50 of that time is actually done doing an actual interview. So like beforehand, you're gonna actually send a job description and a resume just so they can see what actual job you're trying to apply for, so they can tailor the question specifically as if you were actually applying for this job and having an interview for this specific job. And the cool part about this, some people may not like it, but I really loved it, was that you get recorded. So they actually record you, and it's so cool to see like all the little things you do. Like I know I talk a lot with my hands, and it's pretty good. Like it's okay for a presentation, but when I'm sitting down with an employer, I need to like learn how to just keep my hands down and talk. I really love to, when I have my necklace on, hold on to a necklace or like a bracelet, and I tend to stutter a lot, and I'm just like and that's obviously not professional, and it looks really bad. So I was able to actually do a mock interview myself for all the interviews I had to do for getting this job, and it actually helped me so much. I mean, I landed the job, so I would definitely say that's a really good resource to use. RAM Career Ready can also help you with resume help. This is kind of like a 24-hour service. You can use this when you're at home, it's like 3 in the morning and you really need help, and you're like, oh my God, the career center is closed. How am I going to get help this early? I need this to be done by 9 a.m. tomorrow or something like that. You can definitely go onto RAM Career Tools. All you do is, you're going to have to, if you've never been on this website before, you're going to have to create a new user account, but it's definitely okay. I would definitely recommend for you to use the same credentials that you use for your Canvas, just because it's the same, you won't forget it, and you know, I tend to forget my password all the time because it's like it has to be 15 digits or letters long. I don't know why, but that's just stressful. So let me go ahead and log in here real fast. Cool. So this is what it looks like. This is like a module-based system, and this is also really helpful. We really recommend this website for students to use as well if they're kind of confused on, they know what major, they graduated with their major and all this, but they're still confused on what career path to get in regards to their major. They can do some of these small explore quizzes just to kind of understand a little bit more about themselves and know what to do, maybe what jobs to get, what kind of field to go into. But, okay. Sorry, this website just gives me trouble all the time. But once it pops up, there's going to be explain, explore, explain, and can we go back? Okay. Explore, experience, and explain. So here in the explain part, when you go on to resume and cover letter, let's say start a resume, it actually will make you fill in little things about yourself, like what makes you unique, what makes you stand out, what courses have you taken in regard to this field you're trying to go into, and then it'll kind of like create a resume for you, which is pretty cool. You just have to fill this stuff in. You can definitely use that tool. And then same with cover letter. And then I'm pretty sure there's also one of interviewing. It'll ask you some interview questions on like your unique skills, what things to really say when you're with an employer, things to really talk about, all of that stuff when you're with an employer, depending on the job and what skills you have. That way you can sell yourself to that position. So you can definitely check that out. And just before I go, did you all know that you all have, you can all go down and be seen by a career educator? So we have around, I think 7 or 8, we're still getting people in and people out. So we have around 8 career educators. They're all for a specific college. However, any career educator that you were to go into and try to make an appointment for, they'd actually sit down with you and talk about whatever you need, and anyone would be very beneficial. So that career educator specifically can sit down with you if you, let's say you really need help, maybe looking for a specific job in a specific kind of field you want to go into, like some of you women, let's say you guys want to become doctors or something. You really need help in a specific kind of doctor that there are, like I don't know what kind of doctors there are, but like let's say you want to be like a surgeon and you really need help with the application or something, or really just need help finding a specific job in regards to that before you start out and go to med school and all of that. You can actually sit down with a career educator and talk about all of that. They can also sit down and tailor your resume as specific as you need it to be for a specific job post that you have. They can also do interview prep with you, and it's kind of different than a mock interview. You won't get recorded, but it's kind of like a mock interview. You still get to sit down, and they'll ask you questions, and they'll really try to tailor an interview in regards to the stuff that you need help with. So yeah, those are just appointments, and for those you do have to call us at the Career Center to try to set those up, or just go down and say, hey, I need an appointment, what day works best, and we'll do that for you. And then last but not least, we have a couple events coming up that I really recommend for you all to go to. I'll go on this events. You can check all our events on here. I know we do have Biotech Connect coming up pretty soon. I feel like it's in 2 weeks. And that will really, we're actually going to have employers in the field that you all are doing. You can definitely come in, sit down, and talk to an employer. And it's going to be kind of like a little networking event. So it's really cool to actually just get your foot in the door, talk to employers, tell them your skills, maybe get some business cards, maybe you'll be provided with maybe some internship opportunities or even job opportunities and job applications. So all of that's coming up. FedConnect is also coming up soon. If you're trying to get a job with the federal government and all of that, definitely I recommend for you to go to that as well. And those are kind of the events. Did any of you go to the career fair this upcoming, it was the past few weeks? No? Are you all going to be here next semester? Perfect. So we have another career fair in the spring. So definitely go. We do have a lot of different employers come, whether it's in the field you want to do or maybe just you're kind of exploring a little bit. Definitely go on to go to those career fairs. They're going to be next semester around February, I believe. So definitely make sure you go to those. But that's all I have for now. Do any of you have any questions for me? Want to know a little bit more about something? Did I miss something? No? Perfect. So again, my name is Leslie. I'm the student ambassador of the Career Center. Write this number down. Everybody take a pen out and write this number down. 970-491-5707. And that's our Career Center number. So I really expect all of you to give us a call within the next semester if you need help with anything. And we'll see you there. Yeah, thank you. Exit out of this thing. Yeah, of course.
I can take care
Cool.
of that. If you're good with that, you're welcome. Just as a reminder to all of you, of course, Ben Wyrock and Katie Brumfield are still available to you through the Colorado School of Public Health. But those of you paying full-time student fees, so that means you're enrolled in how many credits in a given semester? Yes, yay. You all have access to the CSU Career Center if you want another set of eyes on things. Next up, we have Abby Ross from the CSU Health Network, and Abby also has one of our alumni here with us, Chase Thurkelson, who is a Health Network employee. Hi there, I'm good. How are you?
Hi everyone, how are you? Good. So are you guys, just so I'm clear, this is like your first semester in the program? Yes? Okay, how many of you are new to CSU? Welcome to all of you. That's a lot of you. Well, welcome. So I'm going to talk about your Home for Health today. My name's Abby Ross. I am the Web Multimedia and Marketing Specialist for the Health Network. I kind of have a cough for whatever reason, so I apologize in advance. I'm like coughing through this presentation. So we're going to talk about your state of well-being today. So a little bit about the CSU Health Network, and there are pamphlets and like informational cards back there for any of you that want more information about our services. We have like a little contact magnet and after hours and emergency care cards. Those are back there for you. So the CSU Health Network is available to all enrolled CSU students regardless of your health insurance plan. And so I cannot stress that enough, that regardless if you are on like the CSU Health Network insurance or you're coming in with your own private insurance, we do bill insurances. So please like do not think that insurance is a barrier to our services, because it absolutely is not. Our main goal is to support students' academic success. We have a ton of great providers and counselors and employees who are really passionate and experienced in college health. That's what they have studied and are passionate about, so they really know what they're doing. We also are accredited by the Accreditation Association for Ambulatory Healthcare, the AAAHC, and the American Psychological Association, the APA. Okay, so the Health Network is broken up into kind of three main sections. We have our medical services and our counseling services, and then our health education and prevention services. So I'll kind of be talking about all three of those. If you guys have any questions, please feel free to stop me as I go. First, I'm going to share a little bit of information about the CSU Health Network, and then we'll kind of dive into those three kind of subsections. So just some by-the-numbers facts. This is from fiscal year 16, so not this past year, so it's about 2 years old at this point, but we haven't kind of fully integrated our updated numbers. But over 15,000 students use the services at the CSU Health Network, which is great. 86% of students surveyed would recommend the CSU Health Network to a friend, and 91% of students surveyed would return to the Health Network for services. So those are definitely numbers that we're very proud of. Okay, so just kind of a little quiz to wake you all up this morning. What medical services are available at the Health Network? A, primary care, urgent care, and pharmacy. B, psychiatry and physical therapy. C, dental and optometry. Or D, all of the above. What do you all think? All of the above. Yay. Okay, so let's talk about our medical services, and these are on the panel cards that I have provided as handouts back there. We have general medical and specialty medical services, general being primary care, urgent care, behavioral health, immunizations. We do have a lab in case you ever need to get your blood drawn. We also have a pharmacy. It's located on our first floor, so you can pick up your prescriptions right on campus. And we do have radiology. For our specialty medical services, we have allergy and asthma. We do have a dentist, which is great. That's kind of one of our services that most people wouldn't think that we have in our health center. We have men's care, massage therapy, physical therapy, sports medicine, travel medicine, and then we also have a women's clinic too, just to kind of go through some of those. So counseling services, counseling takes up pretty much our entire third floor for the most part of our building. And as CSU students, you all get 5 free counseling sessions per semester, so I strongly encourage you all to take advantage of those free sessions. We offer individual and couples counseling. We have groups and workshops. We have drugs, alcohol, and youth program for people who may struggle with substance abuse issues. We have post-hospitalization support, crisis intervention, and then you guys can definitely have consultations with colleagues, parents, and we offer all of that for our counseling services. And then last, we have our health education and prevention services. So that's the office that I work out of. We do a lot, that's very awkward as I'm breathing into it. We offer a variety of things out of our HEPS program. That's kind of how we abbreviate it. We have substance abuse prevention. We have a lot of mental health initiatives like Notice and Respond and suicide prevention. We have a peer education group called Cruise, and they go out. They're specifically active this fall semester with the stadium being on campus. They're doing a lot of alcohol education at the tailgates before the games to just ensure that students are being safe. We have resiliency and well-being initiatives, sexual health initiatives, tobacco cessation, and then you at CSU. So just some after hours and emergency care information for you all. So the CSU Health Network is only open Monday through Friday, normal business hours. So we're open pretty much from 7:30, 8 o'clock in the morning, and we do close around 5. So your first stop definitely as a student at CSU is obviously the CSU Health Network. It's on campus. As I've already talked about, we have medical and counseling services. But just in case we're closed, we do have phone helplines. We have an after-hours nurse helpline that's available 24/7. So if you guys, don't feel well in the middle of the night and need to talk to someone maybe about your symptoms, but you don't feel like you need to go to a doctor, definitely please consult this helpline. We also have a mental health crisis intervention line that you can call at any time. And then there is a list of local urgent care and emergency room facilities that you can find at health.collegestate.edu. And I also provided an after-hours and emergency care card with that pamphlet that has all of the local emergency care in the area on there too. So to get to the exciting part, this is the CSU Health and Medical Center, and it is brand new, and we are so excited about it. So it just opened in June. It is located on the corner of Prospect and College, and how many of you all have seen it or have been in and checked it out? Okay, so fair, yay, this is, did you guys get a tour or something that I don't know about? It's wonderful, we're so excited. I have a couple pictures that I'm gonna show you guys just for fun and for those of you who maybe have not been in the health center yet. But just a little bit about it. Finally, all of our services are under one roof. So before, medical services were located in Hartshorn, which is kind of by Campus Rec, basically. And then counseling was located in Aylesworth, and then the health education and prevention services were kind of in this awkward satellite building off of Shields and Pitkin. So for the first time in years, we're all under one roof, which is great. And this has really allowed us to provide state-of-the-art care, and just we finally feel our building matches the services that we're providing to our students. What's really great about the CSU Health and Medical Center is this partnership that we have on our first floor. So the CSU Health Network occupies entirely the second floor and the third floor of the building. The building is 4 floors. The 4th floor is not being built out yet, so stay tuned to whoever is the future occupant of the 4th floor. But the first floor is unique because we have basically a little suite that houses Associates in Family Medicine and UC Health, and then Columbine Health Systems also has a infusion center there for anyone who's needing any IV treatment. But what's great about this is Associates in Family Medicine is providing after-hours care and walk-in care during the evenings and the weekends. So for those of you who may live close to campus and the CSU Health Network is closed, we definitely encourage you to go see Associates simply just because of their close proximity to campus, and they are just right on the first floor, which is very convenient. So some exciting pictures of our building. This is, for those of you who haven't been in, it's a 4-story spiral staircase right in the center. There's over 250 hand-blown glass balls that hang from the 4th floor all the way down. So that's just kind of a picture of that. One of our waiting room areas. And then this is one of my favorite rooms in the building. So this is the Still Point Reflection Room, and there's been a lot of like articles in the Collegian and stuff lately about like what they call the nap pod. Please don't use that word. Please use the relaxation pod. But it's very cool. I strongly encourage you all to check it out. We really are trying to focus on giving positive behaviors to students through resiliency and well-being and stress reduction, and giving students the tools that they need to kind of reduce their stress before it really becomes a problem. So this is on the 1st floor. We have like yoga mats, and it's a place for people to come and do yoga, just relax, meditate, prayer, kind of whatever you need. And then this is a picture of our relaxation pod. So you can reserve this for 20-minute sessions if you just need to maybe close your eyes and relax in the pod. We strongly encourage you to do so and come and check it out. And then this is our pharmacy too, also conveniently located on the 1st floor. So another question for you all: who has full access to services provided at the CSU Health Network? Oh, so the answer is all enrolled students regardless of your health insurance plan. So faculty and staff cannot access the CSU Health Network services. It really is only for students. But like I said at the beginning of the presentation, do not let your insurance, feel like a barrier. We do bill all insurance companies, and we will take all insurance. So as previously stated, if you're an enrolled student, which you are, regardless of your insurance plan, we will see you. We are in network with most major insurance companies. If you do have private insurance, there is an insurance billing office on our 2nd floor that you guys can call or walk in if you have questions whether your insurance provider would be considered, like if our CSU Health Network would be considered in network or out of network with your insurance. Please come stop by and call us. And basically how that works is if you were to come in and see us, we would bill your health insurance always first, and then any that your health insurance did not cover, we put on your student account, and then you guys would pay off of your student account. So that's how insurance and billing works at the CSU Health Network. Oh, yeah, please do.
Do part-time students need to pay an additional fee to have access, or is it regardless of their students?
So this is for full-time students. Part-time students do have access, but there is a different fee that they have to pay. Great. Yep, exactly. Yeah, you're welcome. Yeah, definitely. So then I do want to make a quick plug as I wrap up here. We are having a student health fair and open house. It's coming up. We're very excited about it. So it's going to be on 2 different dates, so please write these down, October 16th and October 19th from 3 to 6 p.m. So there's going to be free food, there's going to be chair massages, we're going to have yoga, meditation sessions, over 30 plus booths with free giveaways. It's really exciting. I'll give you guys a second to write this down, and then I'm going to show you the part that I'm most excited about. I'll give you guys a second. So 3 to 6, October 16th and 19th. It is at the Health Center on the corner of Prospect and College. Okay, so the part that I'm most excited about is the fact that we have smoothie blending bikes, and I just think it's the coolest thing ever, and I'm so excited, and I think you guys should all come and check them out. Basically, you just ride the bike to blend your own smoothie, so please come and take advantage of that kind of fun opportunity, and check out our building, check out our services, and then check out all of the other health-related resources that we as a CSU campus have for you all. So that is the end of my presentation about the CSU Health Network. Do you all have any questions that I can answer for you? Great. I'm going to assume that I said what I needed to say then. I hope you all have a nice day.
Thank you, Abby. So great to see you. I'll just give the Health Network a free plug. I used many of their services when I was a graduate student here, and cannot speak highly enough about the Health Network. So I encourage you to check it out. Great. Next, I will invite up Heidi Zuniga, who is our librarian liaison. So she will have some great information for you on the CSU library. Let me just pull up a new tab for you, Heidi. Not at all. Okay. There you go. Is that good for you just to get started? Just gonna get to. That's kind of strange. Okay. Okay, so my name is not Jocelyn Boyce, which you may see on the literature. I'm actually a new librarian here. I just started last month, and I am your liaison for public health. So I hope that all of you will come and see me if you need help with research or any information about the library as time goes on and you get more into your projects. So I'm not seeing that on this screen, so I'm going to be looking up here a little bit. So how many of you have already been to the library? I hope a lot of you have. Good. Okay, and I hope you'll continue to go. And if you haven't checked out the website, that's also a great place to get started. So I'll just show you how to navigate from the CSU page. So if you just click on resources and go to libraries right there, you'll get to the library homepage. And I'm just going to kind of give you a brief overview of our services and resources. And if you want more information, please contact me. All right, so to start with, we have a big search box there called Primo, and this is brand new. So we're all kind of getting used to it too, but it's a great place to start for just general searching. If you do almost everything, you're gonna get a lot of stuff. That'll be books and articles and all kinds of things. But if you kind of narrow it to books and more, that's more like your traditional library catalog. So you'll see a lot more books and things like that. Let's see. So since you guys are graduate students, you probably won't necessarily have to do a lot of Primo searching. It is really a general tool, and it can help with topic narrowing. I apologize. I'm getting over a cold, so like most people at the start of the semester. So what you guys might be more interested in starting with is actually our A to Z database list. Let's see if it's going to load. And so what you'll see here are just basically all the article databases that the library subscribes to. And you can narrow by subjects, and I don't think that they have public health up yet, so I intend to see if I can change that. But if you go to something like agriculture, you'll see that it narrows some of the databases down, and you can see the librarian who's in charge of, it looks like it just went to anthropology. Now, one hint I'll give is that if you want to change subjects, you'll want to clear so that you can start from fresh. Otherwise, it'll kind of stack those subjects together and eliminate the others. So a couple of databases I wanted to draw your attention to would be under C, for example. We have CAB Abstracts and Medline combined. Have any of you used that database before? I think it's a pretty good resource for public health. We also have PubMed and Medline and a few others like that, but you can see if you go into it, you get to this general EBSCO platform, and if you see up here, it tells you what database you're in, but if you want to change databases, you can click on that. And it should be showing, so it's showing you the ones that it's searching now, but we have a lot more it's a little bit hard for me to see. So if you do show all, and then, I don't know why it's not showing, we have like 40, so that's a good place to do some really more specific searching for your subject. And I'm just gonna do a quick test run. I'll do Zika because it's really easy to spell. And so you can see it came up with some hits for that subject. And if you want to get to the full text, it may not be in that database, but if you click on that, find it at CSU, it will go out and search all of our resources to see if it can pull the full text for that article. And in this case, it found it in a different database. It found it in Science Direct. So you click on that. And
it should have full text. It looks like we have a little error there, and definitely report errors to us so that we can fix them. But that's that Find It at CSU button is how you would get to full text. All right, let me see what's next. Back to the home page. Let's see if it's there. Going to do that. Okay, so just a couple other things I wanted to point out. There's a button on how to print. It's a little bit complicated. At the library, you have to use RAM cache, and there's a couple things that you have to do. Study room reservations, course reserves. That's a place where your instructors can put or print course reserves. They can also connect you to course reserves through Canvas. News and events. And then another spot, research guides. Again, as I said, I'm new, so there is an older public health guide right now that exists, but I'm in the process of kind of redoing it. So there's not a lot of information on there right now, but you can see, if you scroll down, there's all kinds of different subjects. And you can see public health there. And that guide is undergoing a good sprucing up. So let me see what else I want to cover. You can search the library's website itself, and there's an A to Z list down here, as well as this button. So if you're searching from off campus, and remember where I showed you the Find It at CSU button when we were in the database. If you haven't signed in to off-campus access through this right here, that's okay. You can go to that Find It at CSU button, and you'll be challenged with a login at that point when you try to get to full text. And you'll do your EID and your password, and then you should be able to get to full text. But if you click here first, it'll let you in, and then you should be able to get to full text without having to get to the article point. We also have a lot of ebooks available, some in public health. I think there may be some that are used in your courses, but they could be older editions than what you're using now. So, and let me see. We also have interlibrary loan service. So if there's a text book at another library that you want, we can have it delivered really quickly. And you can also use your CSU card at the public library or vice versa. Okay, and then I think just a couple other little things. We have an Ask Us chat that's staffed 24/7. During the day, it's staffed by librarians, and then at night, it's outsourced to other places. But that's a great place for quick questions. Contact a librarian. I'm open for consultation, so if anybody wants to set up a time with me, we can talk one-on-one. I can help you refine your research topics or help you find full text or any number of things. And then there's lots of other librarians to help with other specific biomedical and other. I know public health encompasses a lot of subjects, so there may be other people besides me who would be good to talk to. And I think just one last thing that I thought was neat, as I've gone through orientation myself, inside the library there's a place called Rams Kid Village. So if anybody has kids out there and they're studying in the library, it's $15 a semester, I think, and ages 1 to 11, they can watch your kids for up to 2 hours inside the library while you're studying there. So I thought that's a pretty affordable service. So so that's really nice. Do you guys have any questions, or did I skip anything that you were hoping I would cover? All right. Well, you guys can find me on the website, and let me know if I can help you in any way. Thanks.
Thank you so much, Heidi. And I will also send out Heidi's contact information to all of you by email. Last but not least, for student services, we have Jenny Levin here from the CSU Writing Center. So come on up, Jenny.
I do just want to reiterate that the library services Oh, yeah, that's fine. Yeah, so the library services are really excellent here, and I have used the subject librarians myself and also the Ask Us feature when I have very specific questions about research that I'm trying to figure out, so definitely do make the most of those library services. So as Erin said, my name's Jenny Levin. I am the Associate Director of the Writing Center, and I also teach composition classes here at CSU. So on the back table back there, I have some bookmarks for you about the Writing Center, and if you want more information about what we do, and you just want the specific information about ours, you can definitely grab one of those. As you can see, we are all about creating better writers and better writing. And so what we're trying to do is help you to develop your writing, but also to help you develop confidence and skills in being a better writer as well. So what I want you to think about just quickly is, when you think about your writing, what concerns do you have? I know for me, when I started graduate school, I had been out of school for a little while, and I'd also studied in England for my undergrad. So some of the concerns I had was just not really knowing about how the papers here should be formatted, and just feeling a little bit out of my depth. And I didn't know about the Writing Center, and I didn't use the Writing Center in graduate school. I think the perception sometimes is that this is for undergraduates. And so I want you just to know that we are here for you as well. And so think about, is there any point in that stage of in the different stages of writing where this could be helpful for you? And where would it be helpful for you to think about having a conversation with somebody about that writing process? So maybe it's before you even start. Maybe it's just getting a final look at something. So just think about those ideas and plant that seed. So what we do in the Writing Center is we aim to have conversations with people about about writing. We try to make this as interactive as possible. We have 30-minute appointments, and we ask a lot of questions. And we're here to help with any stage in the writing process. So even if you're just beginning a research project and you're really not sure where to start, we might help you with brainstorming. We can help with organizing a paper, formatting, and then also just going through and seeing if there are patterns of error in your writing. But we want to try and make this as interactive as possible. So we primarily aim to have conversations rather than just like us editing a paper for you. That's not what we do. When we have Writing Center appointments, we follow what we call the hierarchy of rhetorical concerns. And so what this means is that we will try and look, first of all, at these bigger aspects of your papers first. So we'll look at, like, who's the audience for this? What's your purpose? What's your focus? And we'll try and help you make sure that you're hitting those areas first before we get down to grammar and mechanics, because those are usually the smaller aspects. And so those are the things that we emphasize then. So our locations, right now we're in Eddy Hall, which is opposite Clark, not far from the library, in the basement. So we're in room 23, and we're open there Monday through Friday, usually 10 to 4, and on Fridays just 10 to 1. And then in the evenings, we're also in Morgan Library as well. So we have 3 different types of services that we offer. We have our face-to-face consultations, which are our most popular services, but then we also have 2 different kinds of online appointments as well. So we do an online draft review where you can submit a paper to our online system, and we ask that you give us a few days to look at that, and we'll email you back with some feedback about things that you could improve. That one's a little bit harder for us because we can't ask you questions, right? So it's harder for us to have a good interaction, but we do our best with that. So we ask that you upload your paper and any requirements that you have so that we have a good understanding of what your purpose is in that paper. And then we're just getting started with some video conferencing appointments. We have a lot of new staff this semester, so we're just training our staff, and we think that those will probably go live in a couple of weeks. So we will be doing video conferencing. So what that means is that instead of having an appointment face-to-face in the Writing Center, you can be at home or wherever you need to be and meet with us online. Okay. So we do ask that you make appointments. We used to accept walk-ins, and I think our website still says that we do, but it's been so busy this year that it's always best to make an appointment if possible. So if you go to our website, which is writingcenter.colorado.edu, there's just a make an appointment link, and we ask you just to fill out a little bit of demographic information, and then you can just make those appointments. So all of those services are available through our appointment system. So this is my contact information. If you have any questions about the Writing Center and how we might be able to help, you can shoot me an email. And that's the Writing Center phone number too, and you can call our front desk as well. So like I said, I have bookmarks at the back. If you want to grab one of those, it just has all our information on it. Does anyone have any questions now for me? Yes. Yeah, we don't have all of them up to date. I would say that if you were going to look at style guides, the library probably has the most recent ones available, more than we might. It's something that we've been working on updating, but it's not something that I can promise you that we will definitely have. So, yeah. Okay. Any other questions? Okay. All right. Thank you.
All right, we're going to skip back on the agenda and get into capstone information. If you don't mind, if you all just want to stand up and stretch for a few seconds, go right ahead since we had to skip our break. And again, if you do need a break at any time, I invite you to take one for yourself.
This being a public health group, I do want you all to stand up at least.
There you go.
Oh, good. I like the stretching. Excellent. Okay, I'm going to be fairly quick because as you go through the process, the capstone is something that I really encourage you to come and talk to your advisor about. So don't skip that step. Right now, I am the advisor for animals, people, and the environment, global health and health disparities, and health communication. So if you're in those concentrations, come and talk to me. Come talk to me early and often, and we can kind of brainstorm and decide at some point whether it makes the best sense for you to merge your practicum capstone experience into one, or whether you really want two very divergent experiences, because a number of students really want to work with different groups for those different activities. And based on what you really are trying to do professionally, that can be a great conversation to have. So, and then Dr. Nelson is the advisor for epidemiology, physical activity, and healthy lifestyles and public health nutrition. So you now know who you need to talk to. We are here to help you identify organizations or just really talk about what it is that you want to accomplish as you're thinking about this. Because this is really supposed to kind of cap your training around a specific project. And as Kendra said, this is not a thesis, but it is a defined project that we want you to focus on. There is a tangible end product. It can be very diverse. Some people design a website. Some people actually design an evaluation. Some people conduct an evaluation. It can be an educational brochure. It can be a full-blown research activity that you do with an organization. It really depends on what it is that you want to develop expertise to do as you're going through this. But there will be a tangible product. It can be related, as we've said, to the practicum. Sometimes it's not. You will present it at a public health forum, and the best way to really understand the diversity of the kinds of projects the other MPH students have done is to go to the public health forum. And we have one every fall, every spring, and every summer. So fit it into your schedule. I'm not going to give you the dates. You'll get plenty of update on that. But in general, we have the fall practicum. The
next to last week of classes, so that you're not taking finals, you're not in your exam mode. And then it's a similar timing for the spring semester. It's usually the next to last week of the full semester. In the summer, it's a little bit later. It's a little bit more difficult to tell you exactly when it's going to be. It's usually sometime in July, but some of that will depend to some extent on who is enrolled and where they are. If they're going to be away, we do try to move that one around so that students can actually physically be here to do the public health forum for this summer. So step one, contact your faculty advisor. Before you try to do anything, just contact us and come talk to us. Step two is decide which semester you want to do the capstone project in. You can complete it, as we said, in conjunction with the practicum, but you might not want to take on both of them in the same semester. You might want to postpone it. But think about whether it's going to be a fall, spring, or summer semester that you really want to be doing this project. Contact us and request that you be added to the pre-capstone course. Unlike the practicum, I'm not going to send out an invitation to all of you for the pre-capstone because I don't want to confuse you. The dates change on for the capstone assignments and when they're due, and we update that on the pre-capstone website. But you do need to be enrolled in the pre-capstone course before you can enroll in capstone. Step two is step five, sorry. You have to accept that invitation. If you don't accept it, you don't get enrolled in the class and you won't have access to Canvas. So just a reminder, let us know, we invite you, you accept the invitation, and then you're added to the pre-capstone course. Review the information that we provide there. There's a draft of the protocol, the proposal that you need to prepare, and you will prepare that draft. Remember, this is a draft. It's okay that it's not final. The signatures don't need to be on it. It is a draft for your advisor to review to see if we think that it's a realistic project that you can accomplish in the time frame that we want you to work on in. The biggest problem we have is getting you scaled down to a project that you can complete, because we're really only asking for about 60 hours. A lot of people put in more time, but your eyes are bigger than your stomach when you're thinking about doing a project. And our job is to make sure that we're controlling that so that you and your preceptor don't get carried away thinking that you're doing a full dissertation. We want you to have something that you can actually finish. You post the summary of the pre-capstone course, and you let us know that you posted it, because we want to know that you're communicating with us. So when you post that draft, just send us an email, one of us an email, and tell us that it's there so that we will go out and look at it and get back to you with any feedback that we have. At that point, once we have reviewed and discussed with you any changes, then we will inform Erin that it's time to send you a capstone course code. So you each will get an individual code in order to be able to enroll in the actual capstone course. And then you will put the final draft of that proposal into the Canvas for the capstone course, not in the pre-capstone. That's the draft stage. The final stage goes into the final course. That's it. So just some examples of some recent organizations where capstones have been done. Team Wellness and Prevention is here in Fort Collins. The Centers for Disease Control and Prevention, again, this is the Fort Collins section of the Centers for Disease Control and Prevention, although if you wanted to work with the CDC in Atlanta, that's another option. We've had students working with Sustainable Schools International in Cambodia, and for those of you who are watching the Friday monthly sessions, Tavia is going to come and talk to you specifically about what SSI has done and what some of the students from our program have been involved with, and she's a graduate of the public health program. Colorado Department of Public Health and the Environment, of course, is one of the places that's taken a lot of our students. Children's Hospital in Denver, any children's hospital anywhere in the country would be another organization. Obviously, the World Health Organization, students have combined practicum and capstone with the World Health Organization in Geneva, the Weld County School District, Hunger Free Colorado. There's really a wide range of opportunities that you can work with. The International Committee for the Red Cross, also located in Geneva. And then we've had students go to India and a number of other places. So it's not all in your lap to decide what organization you might work with. If you have an organization, just come and talk to us about it. But if you have a particular area in the world that you want to go and it's not in Colorado, come and talk to us, and we can share with you organizations that have worked well with our students. Not every organization that one of our students has been placed with has been a good fit. So please do use our experience so that you don't go down a path that's going to take you somewhere that's just going to frustrate you. Just a few titles up here for you. And so the specific requirements that you will complete is you do the proposal. You'll do an abstract, which is 250 words, and for those of you who like writing, this is going to be one of the hardest things you do, is to get it down to that number, and we are here to help you. We're good at editing down and making sure that you capture what's necessary to communicate. You'll do a formal presentation, which is about 10 to 12 minutes at the Public Health Forum. You will prepare a formal poster, and you will stand at your poster and discuss in a different kind of setting than just the 10 to 12 minute presentation. You do a final paper. We do ask, not everybody does, but we do ask that you meet with us at least 3 times during the semester when you're enrolled. We're here to help, and we can't help if you don't communicate with us. And it is because we don't know where you are in the process of working on the capstone during the semester. You're supposed to be working on it. If you don't communicate with us, we can't help make sure that you can wrap it up, or that you be prepared to take an incomplete to move it into the next semester. So that's one of the reasons we like to have you come and talk to us. We also have a formal practice session for you at the point that you're getting ready to give your presentation. You do it to the other people who are enrolled in capstone at the same time with your faculty advisor, and we give you feedback. And that has been highly successful in making sure that you are capturing the meat of what you need to present in the 10 to 12 minutes that you have, and thinking about what it's like to have somebody who knows nothing about what you've done listen to what you're saying and ask the questions so that you can really hone that presentation into a more refined product. So just some pictures for you, the 10-minute oral presentation, the poster session, and we do invite all of the public health faculty who are on the campus, and we frequently have people come up from Denver to go to the poster presentation, and people will walk around and formally talk to you about it. This is something that in public health is quite common, that you have a poster session instead of one of the 10-minute oral presentations. So it's really good practice. We also, you will do a reflection paper. The final paper is a brief description of what you did, because we know what you did after your presentation and your poster, but it's really to give you an opportunity to look at the competencies that you said you bring to the experience, the competencies that you want to develop, and how the coursework that you did wrapped into your development and your progress with gaining the skills. And it's also, I do ask students to also reflect on how the capstone project is leading them down their next professional path, and where they want to go, and how this is contributing overall to their job hunt, because a lot of people are starting that about the time that they're finishing their capstone. Not all of you will, but it's a really good practice for you to move forward. So, are there any questions? Just come talk to me. Talk to Dr. Nelson. Thank you very much.
Okay, I want to be respectful of all of your time. I also, though, want to share registration information with you because that is coming up very quickly. Those of you who do need to leave, please know that I will be sharing these slides with you, and so you can get that information captured in my slides. But if you can stay, I would encourage you to do so. Let me just skip ahead here, and we will get started. There's Buckley, and Buckley's not scared about spring registration. Oops. Hold on. Okay, so just some overview. Spring registration opens on Monday, October 16th. Registration usually opens sometime between 8 and 9 a.m. If you're logging in right at 8 a.m. and don't have access, don't panic. It will all be okay, but sometime the morning of the 16th. And I do encourage all of you to register early to avoid being placed on a wait list. And so that means Monday, October 16th if possible, but definitely sometime during the week of the 16th for your best chance at getting a seat in a class. The ad drop deadline is still a ways away, but that will be Friday, February 2nd, just for your reference. And just a note of when the spring 2018 classes begin. So a reminder that classes begin on different days for all of the 3 campuses. That also applies to things like spring break. So there are different breaks depending on what campus your class is offered through. So I do encourage you to check out the Colorado School of Public Health academic calendar so that you can stay on top of all of those dates and plan your spring semester. In terms of the specific registration process, I'd like to point out that the schedule of courses can be found on the Colorado School of Public Health general website under just the registration page. What you'll see on the page here is you will find, let's see, my mouse is missing. You will find the Colorado School of Public Health course book, so that has a listing of all of the classes that are within our approved curriculum, as well as a general description of each class. So if you want more information on the classes that are being offered, the course book is a great place to look. Keep in mind that there are semesters when each course is generally offered listed in the course book. So it might say that PBHC 5600 is offered in the fall and the spring. That's not a guarantee. That's just a general idea for you of when those courses are offered. Then toward the bottom, you will find the spring 2018 course schedule. You can go ahead and you can click on that schedule, and that will bring you to this section here. And I'm sorry, it's a little bit small for you, but you can click on each of the 3 campuses, and from there, a listing of courses offered on that specific campus comes up. What you'll see is you will see the catalog code, so PBHC and number. And then if you click the plus button there, you'll also get some more information. So one thing that I would like to point out is the class number. When you're registering for classes, you can search for that class using either the catalog code and number, so PBHC 5600, or that class number. The benefit of searching using the class number is that the class number is unique to a certain section. So let's say that you would like to take an online section of biostatistics. You can use that class number to make sure that you're enrolling in the online section rather than the in-person section. So specifically registering in UCD Access, so a reminder that all of your registration is going through your Denver account. I have some specific instructions for logging in and doing so. Again, I'll send these slides out to you by email so you can follow these step by step. But when you're ready to register, you'll log into your portal. You'll then click on UCD Access and the Registration and Records tab, and what you'll do next is select Register for Classes. And this is when you'll then need that course subject area, so for example, PBHC for Public Health, and the 4-digit catalog number, or the 5-digit class number. What you'll do is you will select in the drop-down menu to either search by class number or search by catalog number. From there, you'll enter in the specific course information, click Search. From here, what you need to do, and this is an important step, you'll need to make sure that you click, I am jumping ahead. There we go. You need to make sure that you click Expand All, and that will pull up the specific course. You want to select the course. From there, if it's a class that needs a permission number, so this generally applies to, well, it definitely applies to your practicum and capstone, independent study courses are some examples of classes that need a permission number. You will contact me for that permission number if it's a CSU class. If it's not a CSU class, if it's a CU or UNC class and it's asking for a permission number, you can contact me as well, and then I'll let you know the appropriate person to get the number from. You'll go ahead and you'll enter that permission number. You'll click Next. And then from here, what you need to do is you need to check the course. You need to add the selected class. That will pull up the course here, and you'll click on Finish Enrolling. And from there on, you should be registered in that class. Now, I do encourage all of you then to check on your UCD Access account to confirm that you are registered. So you will see these courses come up in your course schedule if you have successfully registered for a course, as well as your status of either enrolled or waitlisted. Also keep in mind that you want to make sure that you're looking at the correct semester. So if you panic because you don't see a specific class, make sure in your drop-down menu that you're picking spring semester instead of fall. So another great resource for your CSU classes is your RamWeb account. How many of you have looked at your course schedule or anything course related on RamWeb so far? Excellent. Okay, that's great. So I do want to point out some specifics of RamWeb for you. You'll see that any course that you're registered in through the Colorado School of Public Health that's a CSU course offering will show up on your RamWeb schedule of courses. So keep in mind that your CU and your UNC courses will not show up on this site. So again, don't panic if you're not seeing, let's say, your online health systems management and policy course, because that's a course that's offered through CU, not CSU. This account also has the most up-to-date information about your CSU class day and time. So I will update this on the Colorado School of Public Health website at the same time for courses that you are actually registered for here at CSU. The most up-to-date information, real-time information, you can see through your RamWeb. So I would encourage you, like in the morning right before class starts, your first day of class, log into RamWeb, make sure that the class is still being offered in the same room that you're anticipating. Those don't change often at the last minute, but that can happen, so make sure that you're checking there. One important thing to note is I do want you to keep in mind that you will always have a registration hold on your RamWeb account. That hold looks like this, so this box here. That hold is on your account so that you individually don't go into your CSU account and register for classes. So if you have a single registration hold through RamWeb, it's not an issue. You don't need to panic. You don't need to contact me. That is supposed to be there. At the same time, please keep in mind that if you have a financial hold or an immunization hold, anything that looks different from the single registration hold, you will need to call the number listed and contact them to get your hold removed. Otherwise, the CSU registrar cannot enter you into your course. And from there, that's when you get into issues with potentially being waitlisted for classes. So that's a great transition into what do you mean I've been waitlisted, right? So you go in, you register for your courses in the CSU system, you think you're all set. However, because there is a lag time between when you're registering in the CU system, and again, when our CSU registrar manually enters you into those courses, sometimes you do get a seat through CU, and you'll then get an email from me letting you know that you have been waitlisted in a specific CSU course. If that happens to you, again, don't panic. I'm more than happy to talk with you about other courses that you can register for. In the past, no guarantees, but in the past, a good number of our students move off of the waitlist and into the course between the time that they're waitlisted and when classes actually start. And I will contact you if that happens. One of the things that I want to point out is that you will, well, many of you will, it seems like maybe it's 50% of the time, you will get an email from CSU letting you know that a seat has opened up for you. You need to go into RamWeb and add the course within 24 hours or you're not going to get a seat. That does not apply to you. So you actually cannot log into RamWeb and add that course because you don't have the rights to do so given that registration hold. So if you are getting that email from CSU, you can go ahead and disregard it. If it makes you feel more comfortable, you're more than welcome to contact me, but know that on the back end, our registrar has gotten that email as well, and she will go ahead and manually enter you into the course. Okay. Just a reminder that you don't officially have a seat in a CSU class until that course appears in your RamWeb account. And that lag time can be, it's usually 24 hours. It can be up to 48 hours or a little bit more if there's a weekend or a holiday, but we do try to stay on top of getting you registered into those classes as quickly as possible. Again, I'll send you an email if a seat opens up for you, and you don't need to pay any attention to any emails that are coming from CSU directly about enrolling in the class. This is really important too. So we have a pretty well-oiled or well-ironed out system for classes here and waitlist courses at CSU. I do want you to know that for CU courses that you have been waitlisted for, you do not get an email letting you know once you've been moved off of the waitlist and into the class. So you need to make sure that you're checking your UCD account for any courses that you've been waitlisted in so that you don't unknowingly move off of the waitlist and into the class. And I have a couple last important reminders for you, and then I'm happy to answer questions briefly. You must have completed all 3 assignments through the ROPES course in order to register for your spring semester classes. I have emailed each of you individually if you are missing any assignments, so make sure that you're on top of that. You also need to have approved immunization records in Castle Branch in order to register for courses. I have also emailed you individually if you do not have approved immunization records. One piece on those records, you submit them through Castle Branch, and then Kelly and I work together to send those records to the CSU Health Network. So if you're getting emails from CSU, you can certainly let me know that they haven't received your immunization records, but those of you who have submitted everything through Castle Branch up until this point, Kelly and I have sent those off already. Again, just a reminder that some courses require permission codes. You can contact me for CSU courses and then either contact Brenda Witt or contact me and I can refer you to Brenda Witt for your CU courses. Another reminder, all 3 universities have different Canvas sites. So if you're trying to find information on a CU course in your CSU Canvas, you're not going to find it there. So make sure that you keep those sites and logins separate. Textbooks. So you can find course textbook listings on the university bookstore site for the campus that the particular course is offered through. So keep in mind that the textbook information is specific to each campus as well. And then last but not least, a reminder that your full-time versus your part-time student status for access to services and for the amount of fees that you'll be paying to the CSU campus is determined by the total number of course credits you're taking through the Colorado School of Public Health. So even if you're only taking 3 credits physically on the CSU campus, but you're taking a total of 6 credits through the Colorado School of Public Health, you are responsible for paying full-time student fees for that semester, which allows you access to all of our wonderful services here on campus. And just a couple of examples of the services that you have access to, which you heard from today. It's great to see that so many of you have already scheduled advising appointments with me prior to spring registration opening. I do have the link here to schedule an appointment if you still need to do so. And I really encourage you just to come in and touch base with me, check in with me. We can talk about how things are going as well as any specific questions that you have about registration. Okay. If you have specific questions, I will ask you to send me an email about those, call me, schedule an appointment. But do you have any general questions on the information that I just shared? Okay, fantastic. So last but not least, we have Student Council here today, and they have some information for you as well as an activity for you. Again, those of you who need to leave, please feel free to do so, and have a wonderful, wonderful weekend. Thank you.